and good morning. This is Millennium Health Matters Radio Show. I'm your host, Rita Hubbard Robinson, and it is indeed a pleasure to be with you today. Yep, it's another day. We are always glad for the sun to come up and for us to have another day and another chance to make it a healthy day. If you haven't thought about it, perhaps today would be a good day to get a walk in. You know, take a little walk today. It's a milder day today, and it's another day that you can get those 8 glasses of water into your diet. You know, we always want to encourage you to do very simple things that improve your health, that improve your ability for the blood to flow freely through your body, because of course when that happens you're having optimum health in your day. So get your walk in, get your water in. It's good for your heart, it's good for your health, and we're glad to have you with us again today. We've got 2 fantastic guests with us, friends of mine, colleagues of mine. We do a lot of work together. It seems like we see each other almost daily, certainly weekly, and we have a big event coming up. We're going to talk about it today. We're talking today about the intersection between the African American Health Disparities Taskforce, Black History Month, and social determinants of health. We've got a big event coming up. We have Danielle Pelfrey, Duryea. She is a professor at the UB School of Law, and she is a big advocate for seniors and elder health. And then we have with us Pastor George Nicholas. He is, as I said, the pastor of Lincoln Memorial United Methodist Church. He's also the convener of the African American Health Disparities Task Force, of which we all serve. So we're glad to have you both with us today. Welcome.
Good morning, Rita. It's good to see you, hear you and see you.
Thank you for having me.
So glad to have you both. Why don't you share with us a little bit about yourself, why you love Buffalo so much, and how you got to this point in your career. Danielle?
I teach health law at the UB School of Law, as Rita said. That's how I came to Buffalo just a few years ago. And it's hard not to fall in love with the city of good neighbors. So I teach health law. I also teach the social determinants of health and poverty law at UB Law School. That is how I got connected with the African American Health Disparities Task Force. It's an issue that I've been thinking about and researching for quite a while.
Thank you so much. And why do you love Buffalo?
Well, who wouldn't love Buffalo? Except for the snow. No, I love the snow because I'm from a warm climate, so the snow actually is part of the charm.
And this is my home.
Yes.
And it's a great honor and privilege to be able to pastor in this community. I love Buffalo because I love the people here. And, it's just an opportunity to serve. And so I'm excited about the work we're doing. And with the task force expanding, it's allowed us to make connections with people like Danielle, who what's good about her, a lot of things are good about her, but is that she reached out to us, she heard about what we're doing. And she said, well, how can the law school help in this work?
Right.
And that, she displays the kind of spirit that we're building with this movement to, eradicate race-based health disparities.
Why don't you tell us a little bit about the mission of the task force and why it is what it is and what the goals and...
Well, we've been at it since I think about 2014, and really when you look at Buffalo and you look at the community health, you'll find that in the zip codes where most of the African Americans in this region live, there are tremendous health disparities. 300% more likely to have chronic diseases in these zip codes than for whites who don't live in those areas. Just ridiculous numbers of high blood pressure, hypertension, diabetes, heart disease, you name it. The numbers are really, really bad. And so we got together, a group of community folks, and said, we ought to do something about that. And the first step really is to educate the public. And we put out our report that clearly documented the health disparities in this region. And then we began to expand our table and reached over into the university, into the Population Health Collaborative, Millennium. We have AARP now, Project Hope, Jericho Road. There's a number of partners that we have now. We had our conference last year where we had about 300 people who came and had conversation with us about what do we do as a community to eradicate these health disparities. And you know, the obvious conclusion is to address the social determinants of health. And so that's what we're about. We're about making sure that everybody in this community has an opportunity to live a healthy and prosperous life. And that is not the reality right now. And I think we need to be really not afraid to state that truth, because at times people, when there's a sense of renaissance that's going on, there's sometimes a sentiment to just look at all the good things and ignore some real serious problems. And I don't think that's wise, and I don't think that's responsible. So we're trying to provide responsible leadership, saying yes, there are a lot of positive things going on in the region. However, there are some really serious systemic problems that, and it's not exaggerating, that are life or death problems.
That's right.
And they come across those racial lines. African Americans are suffering with really poor health in this region, and we need to do something about it.
And then it's all about the root causes. And
Absolutely.
I think, you know, today we're going to talk about the event that we have planned coming up in just a few days, and we want to make people aware. We want to really help people to understand why this task force is important and why their participation is important. So tell us about the event. It's Reimagining Health, Education and Social Justice, a community forum on the health impacts of exploitive ticketing and avoidable school suspensions on African Americans living in Buffalo. What is this event all about?
So this is, as Pastor George mentioned, we hosted our first conference. The task force hosted our first conference last year, and this is our first Reimagining forum, community forum, really zooming in on a couple of factors relating to African American health disparities that we talked about at the conference last year, but really wanted to dig deep with the community, understand what's happening out there, and to brainstorm, use the community wisdom to map out solutions, and to empower the community, to empower individuals in the community to cope with the realities of these two particular social determinants of health while we move forward with more systemic change,
Right.
as Pastor said.
So,
Go ahead.
now, education is one of the key indicators, factors for short-term and long-term success. And historically, even back to the enslavement of African people, and then following emancipation, the issue or the struggle to achieve and obtain quality education has always been and continues to be a struggle for African Americans, and that keeps the cycle of poverty and just a lot of problems attached to not having that education. Malcolm X said that education is as important an element in the struggle for human rights, and it is the means to help our children and thereby increase self-respect. Education is our passport to the future, for tomorrow belongs to the people who prepare for it today. And so, oftentimes, and Dr. King, said that, paraphrasing, that, when he examined the health system and the quality of health African Americans were receiving, it was one of the worst things that he's seen in terms of the civil and human rights struggle. So attached to those things, when we find that African American children, or go back, if you don't have the kind of education that you can get, it's going to reduce your abilities to earn money.
Right.
And so when you don't have money, you can't be socially mobile. You can't find quality housing. There's just a lot of factors, and all those things lead up to factors that will be detrimental to your health.
Including stressors.
Absolutely. So when you have a disproportionate amount of children in the Buffalo Public Schools who African American children who are suspended and disciplined harshly, then that poisons the education experience for this child, which will increase his or her probability of not succeeding, not going on to college, not doing the things that will help put that child on the trajectory to success. So, which will again make it more probable that they will have all these other health problems related to all the other social determinants of health.
And if I could just add to that, Pastor, the research is really clear that socioeconomic status and health outcomes track one another very closely. So, so education and health have even a reciprocal relationship.
Absolutely.
So that not only does educational attainment, low educational attainment, track poor health outcomes, but you have to be healthy to learn, right? So,
Right.
so
That's right.
there's a cycle there.
That's right.
Yeah, yeah.
And Jay Ray, the Buffalo News, recently did an article on suspensions, and what we're doing here is connecting the suspension rate to health outcomes. We have some of the poorest health in the entire state, really in the entire country, in African American zip codes in Buffalo. And we call this population health. And what we're talking about here is really driving down to the root cause. What are some of the root causes that people are experiencing in volume? When you look at the statistics with regard to those who are being suspended at higher rates, and you look at the health outcomes of those same demographics, you say to yourself, oh my goodness, we are tracking for poor health of African American males, because the suspension rate for African American males are highest of all of those who are being suspended in Buffalo Public Schools.
Yes, and Buffalo is, I hesitate to say a leader, it's more, it's more the worst of the worst in terms of, in the state, and suspension rates, and the stats are pretty shocking. In the article you mentioned, Rita, it talks about a 2016-17 school year report. Black children were 2 times more likely to be suspended in Buffalo Public Schools than white children, and black male students in high school, there's almost a third had at least one suspension of
Right.
black male students in high school. 9,900 plus short and long-term suspensions. In that 1 year, almost 20% of all black students in Buffalo Public Schools were suspended that year. Now, kids can't learn if they're not in school.
Right.
So if it worked, but what do
No.
suspensions do? I mean,
Punitive,
right.
and it's not
It's
instructive.
just really, it
and
really is tracking
Yeah.
for prison.
Absolutely.
So it's tracking for a punitive system. It's not tracking for an educational model.
Right, and then, and certainly, no one's advocating that if a student is disruptive and is disrupting the learning opportunities or impinging upon the safety of his classmates, his or her classmates, that they maybe need not be there for a moment. But I think we need to look at the overall system and figure out what is it about this educational experience for African American young men and women that creates a culture and a breakdown of communication between adults and children, that the only response to aberrant behavior would be the removal of the child from the environment, an environment where our children need more classroom and more instruction time based on people talk about the improvements, and there are improvements, and again, this is the part of the thing where people say, well, you're just being negative, whatever. There are improvement, but there's not equity, and so when we're looking at the educational experience for black children, it's not operating at a sense of equity for white children in Williamsville, and even some white children in Buffalo. And so we need to examine that whole process and figure out, well, what are we doing inside and outside the school? The solution, I think one of the problems, Danielle and Rita, is that, many of the solutions are kind of school-based and not community-based solutions, right? So I can understand in some way it might be logical in some sense if you're just having a school-based remedy for dealing with behavior issues would be probably removal, right? But if you're looking at a more community-based problem-solving model, then I think we can figure out some more creative ways to make sure that child's behavior is modified, other children are safe, but yet we're keeping that child on the trajectory to getting their education and addressing some of the issues that some of the children come into school with, that some may be mental health issues. They may be issues of trauma and stress and things of that nature that, I know of a story of a student. I don't want to get too much detail because it'll disclose. But I hear a young student that witnessed an act of violence that was very traumatic for that child, and so when the child went back into school, absent of having services and support to address what was going on with what he witnessed, that he came in with a sense of fear. And so in order to address, because he was still in the same community, dealing with some of the same folks that he witnessed this terrible act of violence with. And so what he did is he brought not a gun, but something to school with him to make him feel safer, right? And so when he was caught with that thing, no one sat him down and said, well, why would you think that this was the appropriate thing to bring to school? What's going on with you? And why
those are the children you put out of the school in the environment that they need to be protected from.
So they throw him out of school. So now he's still in that community, still in that neighborhood, and not having at least some semblance of safety that the children are supposed to have within the school. And so I just don't think that's the right approach. And he was already struggling with academics. So, so it's just that's not the best way to solve the problem. And they may say, well, we're a school, we're not equipped to address that. But there are other community members that can come in and engage and help these children. So there's that attachment. And then if this young man does not get what he needs, then his chances of academic success have diminished, and now his income opportunities and earning potential has diminished, which will diminish his mobility, and all these other things. And as you said, the stress of doing that.
So we could talk about this for the entire time, but we have a limited amount of time. So there's two things that I want to raise, and then one is that we're going to have a speaker. We're going to have Dr. Nelms in from Rochester to speak with regard to his success around the reduction of suspension in the Rochester school system. So we want to encourage you to come out and hear what he has to say. And also, we are going to be focusing on this exploitive ticketing. I mean, these are two issues that have been raised in the Buffalo News recently, and they've been raised in a reporting fashion. So, but we're really looking at the connection between these things and health. And this is an area, Danielle, that I know that you are really connected to, this whole idea of exploitive ticketing. Why don't you talk a little bit about why and how that connects to health, and then also the speaker that's going to be with us.
Yes, I'm happy to. Well, I'm unhappy to because it's such a trap for folks who are who may be living in poverty or not living in poverty, but are living in policed neighborhoods where folks are just more subject to receiving parking tickets, other kinds of minor infraction citations that carry fines. And fines are quite expensive. Here by state law in New York, the city of Buffalo is allowed to keep all of the fines that are collected from people. So the state law creates an incentive for localities to ticket
As a fundraiser.
Absolutely, as a funding mechanism for the government. And in fact, there are some very interesting studies in other states that track when government revenue to a locality goes down, ticketing goes up. And in fact, when you survey some localities, some folks in localities who are in government, they acknowledge that that's a way of making up shortfalls in funding for a locality to continue to provide services, services that may or may not actually make it to the neighborhoods that are being most subject to ticketing.
And when you connect this to a city that's one of the poorest in the country, right?
Absolutely.
There's a rising of concern.
Yes,
right?
and one of the most segregated cities in the country.
Right.
So, I think a lot of the listeners will be familiar with the institution of checkpoints, police checkpoints in just 3 neighborhoods in 2015. Those neighborhoods were almost 90% African American residents, and there was a 92% increase. It almost doubled the number of tickets that were being written. Not necessarily, the police finding guns or drugs or other things that would be a threat to to community welfare, but just a broken taillight. Tinted windows. One person who was issued tickets during the first part of the checkpoints received 4 tickets for her tinted windows, 1 for each window, and that totaled more than $750 in fines. Now you see how, if you already are under-resourced in your household, how are you going to pay $750 in fines? Then your fines are you're going to get penalties on top of those fines.
Right. If you don't pay them on time.
If you don't pay them on time, exactly. No one is offering payment plans or partial payments as a way to stave off penalties for not paying in total. And then you can easily end up having your license suspended. Then if your driver's license...
And you might not know your license is suspended.
Absolutely. You might not know your driver's license is suspended. Then you get pulled over and cited for driving without a valid license.
Right. And they impound your car.
They impound your car. Or you lose
your
your job. I mean, this can end up with people in prison.
Right.
Here in New York State for not being able to pay a traffic fine.
Right. And then you have a record.
Exactly. Then you have a record. Many jobs may be closed to you, especially those in the healthcare arena. And we know lots of people are working in low-wage work in healthcare in this area. We're a health hub. And so it's a major area of employment that's just closed to you at that point.
So it creates a socioeconomic burden.
Exactly.
And it puts people in a position where they're not going to be able to have, as Pastor George just described, access to transportation, access to food, access to good jobs, all of which have an impact, a direct impact on your health.
Right. Just setting aside.
Not to imagine the stress.
Right. Yes,
Yeah.
precisely.
I mean, life is difficult enough, and especially for those who don't come from money and inherit money, and just things like that. Most of us have to work really hard just to take care of our families, and the last thing we need is the government to make it more overly complicated with unjust and punitive actions that do nothing to enhance the quality of life for working class people. And it's just, it's just outrageous that these things continue to happen. And so we need to organize, and, part of what our work is providing information, looking at policies, advocating for just policies, and building a movement. And that's what we're doing with this African American Health Disparities Taskforce. We're building a movement that's cross-cultural, it's multidisciplined, and it's really looking at really creating that beloved, just community that we want to have.
So we've got just a couple minutes,
Yeah, sure.
Danielle. The speaker is
Yes.
Joanna Weiss.
That's right. Joanna Weiss will be joining us from the National Fines and Fees Justice Center that is focusing particularly on New York State and Florida for reform on this issue.
And the other speaker is Sean Nelms. He's the associate professor at the Warner School of Education at the University of Buffalo. So we're going to have both of these phenomenal speakers to present on their work and their outcomes. We're going to be breaking up into groups, small groups. The event will be on the 28th of this month. It's just a few days, 5 days from today. And it's going to be at the Arts Academy, the Buffalo Academy for the Visual and Performing Arts, right on Ferry and Masson Avenue. We're going to be entering on the Ferry Street side promptly at 4:30 with a meal and registration, and then our event will begin at 5 o'clock, 5 to 8. So there'll be a lot of informational tables. The neighborhood legal services will be there. There'll be the Erie County
Restorative Justice
Restorative
Coalition.
Justice Coalition there. There'll be health tabling there for primary care and information about chronic conditions, particularly cardiovascular disease, because of course we are still in Heart Health Month, and we are concerned always at every event about your health. And I think we have 20 tables there of all kinds of relevant information to your health and to both suspensions and ticketing and where you can get help about these situations. We're going to drill down in those group sessions to make sure that you are empowered when you come out to be a blessing to your own family, to your neighborhood, and certainly to the community at large.
Come out. We're trying. We're trying to provide the leadership that is necessary around these very important issues. And we need all of you to come and join us and be a part of this movement. When I ask that if you heard something that you feel like you could connect to, that you can resonate with, if you have a son or a daughter or a grandson or granddaughter that's been suspended, if you've had somebody that's been ticketed, come on out, and then I want you to call 5 people and tell them where you're going on the 28th, and bring them with you so we can really begin as a community to begin to solve these very difficult problems.
The event is free. Again, it's Reimagining Health, Education, and Social Justice Community Forum on Health, the health impacts of exploitive ticketing, and avoidable school suspensions on African Americans living in Buffalo. It's Thursday, the 28th, from 4:30 to 8 o'clock. At the Buffalo Academy for Visual and Performing Arts. This is Rita Hubbard Robinson. Thank you so much, Pastor George Nicholas, Danielle Pelfrey, Duryea. I apologize for that.
No worries.
You both were wonderful guests today. Thank you so much. This is Rita Hubbard Robinson of the Millennium Health Matters Radio Show. I'm your host, so glad to be with you. Remember, take care of your health because your health matters to us.